This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Just one quick medical minute I was thinking about the other day was for the treatment of SVT. We know that we do just AV nodal blockers for it. And I was going to say there's just really two things that the patient needs to have in order to know it's safe to give adenosine or diltiazem or whatever you're going to do. And just, does anyone know what those two criteria are? It has something to do with the EKG. So there's two things that need to be met. So the first one is that the rhythm needs to be regular, and then it needs to be monomorphic. So if you have a regular and monomorphic rhythm, it is okay to give adenosine. It doesn't necessarily need to be narrow. You can have a wide complex. It's just that if you have someone who is in WPW, then they're going to have this accessory pathway. And so as their heart is depolarizing, you're going to get these abnormal and wide QRSs that happen every now and again. So it will then not be monomorphic. It will be polymorphic. So that's just the only two things you need. Regular, monomorphic. So that's it.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.